Hello everyone, I am Dr. Umar Karadan. I am a senior consultant at Baby Memorial Hospital, Calicut. Today, I would like to talk on a topic of common interest, headache. You know what is headache? Headache is quite common. Headache occurs in around 50% of the population throughout the world, and luckily only 5 to 10% of these headaches are of sinister in nature. The rest, around 90% of the headaches are the usual or the common headache, which we call as migraine headache, tension type of headache, and cluster headache. These are the commonest type of headaches. That is the usual headaches. Then of course there are around more than 200 types of headaches, more than 200 types. All right. So basically, the headache is due to a lesion or the involvement of the various structures in and around the brain as well as the face and skull. Okay. You should know that the brain per se is insensitive to pain, but the coverings of the brain, what we call as the meninges, the major arteries and veins, as well as the some nerves like the fifth nerve, ninth nerve, some spinal nerves, these nerves are pain sensitive. Whenever there is any traction or any distortion or any spasm of these vessels or the structures, the patient can or the people can get headache. So in the same way, if the patient or the person has got some lesions or some damage to the structures in and around the face and skull or spine, he can get pain. That means if the patient has a problem in the eyes or in the sinuses, in the teeth, the temporomandibular joint, in the ears, maybe some arteries or veins in and around the face. Sometimes even heart disease, the heart attack can present or the angina can spread to the neck as well as to the ears and simulating a cardiac pain, especially during exertion. All right. So basically, apart from the primary headache, we have a secondary headache. All right. So these secondary headaches may be due to a problem in the brain itself or in the skull itself, or it may be extracranial. So what are things which can cause a problem in the intracranial problem? You should know that there can be a tumor inside the brain, there can be infection, there can be something like an abscess in the brain, or sometimes the vessel may be blocked, maybe arterial blockade, or the venous sinuses or the cortical veins may be blocked. In all these situations, the person can have neurological symptoms. So what are the various neurological symptoms? You should know that the brain itself has got so many, it's a head area of our body. The head area means everything is being controlled by the brain. Just for an example, your speech, how you speak, and your understanding, how you comprehend your speech. So also the facial deviation to one side, or the ability to see, as well as ability to swallow, ability to think, ability to remember, ability to and move the limbs, and your steadiness or whether you are unsteady. So everything is dependent on some or other parts of the brain. So if the person with headache has any of these neurological symptoms, you should be careful. It's not a normal headache. All right. This may be anything. If it occurs abruptly, this may be vascular, then what we call it as a stroke. On the other hand, this occurs slowly, then most likely it may be something like a bleed there. It can have something like a intracerebral bleed or a subarachnoid bleed or a epidural bleed. This can occur fairly faster. On the other hand, some bleeding like a subdural bleed, because the patient or the person must have had a fall or some injury, and that can present with later on headache and difficulty in walking. Okay. So the tumors also, it can slowly grow until a point comes when the brain cannot accommodate this volume. In that case, the brain tends to shift in various directions, and this can cause traction on the vessels as well as the coverings of the brain, causing headache. So in those situations, people will have problem with the headache will be increased on cough and strain. When he coughs, when he strain, he gets a headache, and sometimes there will be a double vision. Sometimes these headaches wakes him up during sleep. So whenever a person gets all this headache, like headache increase on cough, strain with double vision, headache which wakes him up from sleep, or in early morning headache, you should be careful. Especially, or if the patient has fever with headache, you should be careful. Similarly, if the headache occurs first time and the severe headache, you should be careful. This may be some bleed, like a subarachnoid bleed. Similarly, if the headache occurs for the first time in a person above 65 years old, this may be something different, something what we call it as a temporal arteritis or inflammation of the arteries, or any tumors, or some blood vessel occlusion. All right. So, there are other red flags, like if the headache occurs in a patient with a cancer, you should know that the cancer can, especially some type of cancer like breast cancer, lung cancer, some melanoma and all, can rapidly spread to the brain and cause bleeding there, or secondary deposits there in the brain. In the same way, HIV patient can have differing infection, protozoal infection, viral infection, fungal infection, or even tumors or meningitis, which can lead to headache in a patient with HIV. Or if any patient comes with a headache with gets worse on sitting and better on lying down, you should think of a condition called intracranial hypotension. All right. During pregnancy also you should be careful. If any pregnant patient in the last trimester comes with a headache, or in the post delivery, there is a condition called PRES, posterior reversible leukoencephalopathy syndrome, or the edema into the brain occurring due to high blood pressure, or sometimes the veins in the skull get clotted. It's called a cerebral venous thrombosis. So you should be careful of any person who gets headache in the peripartum region, that is especially before delivery or after the delivery, especially those people without any history of migraine in the past. Similarly, any severe eye pain with headache, with watering, redness and all, you should be careful. Maybe it's a first occurrence of a cluster headache, but it can also be due to a problem in the behind the eyes, or in the cavernous sinus, or in the pituitary. So you should be careful of those conditions as well. So whenever patients gets any of these symptomatology which I have just mentioned, you should be careful. This cannot be a normal headache. Of course, every of these things may not be related to sinister pathology, but you should be careful. So there are so many conditions which can trigger a migraine. This is not the sinister headache, the migraine part. Like especially if you miss a meal, if you are stressed, if you are dehydrated, if you exercise excessively, or if you take certain foods like cheese or caffeine or chocolate and all, which would precipitate a migraine, you try to avoid those. And you should exercise moderately, and try to avoid any triggers which would cause headache or migraine. All right. And if you find that your headache is turning into a different turn, like it's getting progressively worse, and or the pattern of the headache is changing, should be careful. In those instances, you have to get a neuroimaging like a CT or MRI done, as well as you should consult a doctor and get the treatment. All right. So if you get a headache for the mild to moderate, you can take some, you can, after consulting your doctor, you can take paracetamol or some triptans. And if the headache occurs more than 2 times a month, which may it's rather severe, you have to take prophylactic medication like beta blockers, tricyclics, anti-epileptics, and even bottles you can try. So that's what I want to tell you, because it's just a message of different type of headache, and what are the sinister types of headache, and if that occurs, what you have to do. Thank you very much. If you have any comments or doubts, please comment. All right, bye.